Welcome back, and as promised, we are going to look at the economic side of things. But before we get into that, the good doctor, Dr. Philip Muthoka, who's the influencer coordinator, has asked me to point out that it is actually possible for you to do things at home that would help you protect yourself. For example, exercising, eating greens, taking meats that have bone marrow, and of course, capsules that contain micronutrients that are sold in the market that could actually help you boost your immune system. So in the event that you get the virus, you would be better placed to fight it off. But now let's shift gears to the economic side of things. And joining me from our I&M studios is Irene Otieno of the Taxpayers Association. Welcome to the show, Irene.
Thank you for having me here.
Okay, so we'll just jump straight into it. A number of measures have been taken to cushion the common mwananchi. Are you familiar with these measures, and do you feel that these are going to help and actually making sure that we are all cushioned? For example, the government have freed up over 37 billion shillings to ensure that borrowers who are being caught up in all this COVID-19 madness are better placed to survive in terms of business. Do you feel some of the measures that have been taken so far are sufficient?
Indeed, there has been a raft of action that the government has implemented because of this concern of COVID. However, I view this being insufficient, firstly because of the people that it is targeting. You would find that a significant population of Kenyans are not going to directly benefit from these interventions. You will notice that a lot of the interventions have been actually spearheaded through the central bank in the form of them implementing monetary instruments and tools. And so those are majorly geared towards the banks to see that banks can be able to give more to citizens and businesses. But the impact of that is not that it will not respond as fast as would be expected. But what Kenyans currently need is what would put food on their table, what would put money in their pockets, so to speak, because we know some are being laid out of jobs. We have Kenyans that are going now on a half salary. Yeah. So I view that the measures that the government has taken are a bit elitist, but do not really touch what Mwananchi and Wanjiku would expect.
Right. And aside from that, do you have trust that the banks are actually going to, free up said funds and actually make sure that this measure is implemented in a way that it will actually cushion small business owners and people in business? While you've pointed out that it is elitist, is there a level of trust? Can we expect the banks to actually play ball?
I would hesitate to say that they would play ball, and it might not be that they intentionally do not want to lend or give the cash to businesses, but their concern, I'm sure, would be, would these businesses be able to pay back?
Right.
And you remember, even when at the point when we were looking at the interest capping, what central bank mentioned is that we need to let the market forces manage the situation, and so that is why again we remove the interest caps. But the lessons from that again is that businesses are saying they're still not getting affordable credit. So based on that analysis and based on that recent occurrence in our economy, I'm not very hopeful. I do not see the banks doing what we expect, and that is a key concern. So I would say more conversations between the central bank. I think the governor for the central bank came out strongly, very fast when the COVID issue came, to try and to do what his office would do. But then we must then speak to the banks and businesses that it's time they also do business a bit ethically and think not of their bottom line only, but how we can cushion citizens, we can cushion businesses to ensure that all of us get out of this pandemic with something and have not all lost our hard-earned cash.
Right, and ethics and, the directives aside, do you think the time frame then also would be quite a problem? Because while these measures have been put in place, is there a time problem between when they're being enforced and when this actually trickles down to the common mwananchi? True,
that has been the other concern in terms of how fast will this kick in. If you see, one of the issues that the central bank governor had said is that if you have a personal loan, it is for you to negotiate with your bank, and it is going to be on a need-to basis. So the bank will evaluate and see what has been the impact of COVID on your business or your repayment, and then you get into an agreement with them. So obviously there's the issue that it will not kick in or set in as fast as you would expect. And remember, today we are also very apprehensive since the CS for Health said that they are going to announce other steps.
Yes.
So obviously the steps that the government, in a sense of protecting the health of Kenyans, their enforcement kicks in immediately. But on the other hand, the little that the government has done on the economic end does not kick in immediately. So there's a mismatch, and therein is where we see a lot of the citizens it might not serve the citizens as and when it would be most effective.
Right, so putting all that into perspective, then how do you foresee this affecting the common mwananchi? If it takes it takes long, and if some don't manage to get these, measures to be in their favor, to convince their bankers to actually work with them in that way, and if that 35.2 billion shillings is not actually put in effect in a way that will, cushion every single person in business, then how do you foresee it affecting the common mwananchi, and as they try to actually maintain their economic activities and their ways, sources of revenue, also at the same time getting in line with what the government requires of them, which would be to stay at home and not conduct business as usual?
True. Most Kenyans and everyone, I think yourself and I included, are very passionate about our health. So our immediate reaction would be for us to sit home and wait it out as advised by government. But then you cannot wait it out with a family that is waiting for food on the table.
True.
And we know that most Kenyans, it's only around 18% that are formally employed. So these are the people that still are comfortable that even within a lockdown, so to speak, they would still have a pay and be able to meet their day-to-day needs. But for the other around 78% of Kenyans, a lockdown would mean no food on the table, would mean no security, no water in the taps. So then the consequences are dire, and it's a difficult place for government to be. But I think it's a place that government has found itself because of its perennial mistakes. Safety nets must be something that is provided to citizens as a matter of course. You would expect that issues such as water are in all settlements. We are not just talking about informal settlement. Even middle-class estates do not have water. So when you're talking about a lockdown, how are these people even going to put food on the table? When you're saying that these citizens will not go to work, and I even give an example of the matatus.
Yes.
So when you're telling these players in the sector to actually just get the same fare, but get limited number of people in their vehicles, it's eating into their profits. But government is not doing the little things that we have asked, such as get VAT out of essentials.
Yes.
We asked that the pay as you earn can be deferred a bit, so that even the people in formal employment then can be able to be cushioned, so that they also take care of other dependents. But government has been very direct in saying that that is not an option on the table right now. And we understand, because it's, as I've mentioned, our perennial problems. We have taken on too much debt so that government doesn't have fiscal space. If the government had fiscal space, this is an option. Because the reading from what the G7, the G20 countries have recommended, and even through IMF, is that you need to give tax reliefs to households. You must pay, even sick pay must be enhanced a bit. So there's a raft of international recommendations that other countries have taken. But you will note that these countries are the developed countries that obviously do not have the corruption issues that we have, that do not have the debt that Kenya is contending with, that then reduces the fiscal space, that government cannot give the exact things that we want, which, as we have said, is actually sets in immediately, such as remove the VAT on essentials, give people money, say that you have the database of your citizens, give each household something to ensure that they are sitting in their houses, but it then does not mean they are missing out on food and missing out on essential human needs that they must have.
Right, Irene, but then one would argue that our economy was already in the hole before this whole thing happened. So would it be realistic to expect the government to go down or easy as far as taxes are concerned, because we're already struggling as it was?
And that is what I'm actually mentioning, that our problems go way, way far. And so even the demands that we are making of government right now, they do not have that leeway to do it, even if they wanted.
True.
So it's a catch. It's just a situation that we cannot get out of, but we will not miss an opportunity to remind the government that they have set us up for this problem, because we have been flagging out the issue of debt.
Yes.
And the parliament just upped the ceiling on the debt, so that is a concern. So I think even institutions have really failed Mwananchi. Mwananchi have paid their taxes as required, but government has not done its end of the bargain. And as you say, for the last 5 years, Kenya Revenue Authority has not gotten any of the targets that it has set in terms of revenue projection.
Yes.
So obviously they'd be averse to this discussion of a tax break. So that would be something that would already further deep the shortfalls that the Revenue Authority has been having. But as I said, we will not miss an opportunity to remind the government that they would be able to afford us the reliefs that other countries are affording their taxpayers, were it not for the corruption, were it not for taking on debt that is unwarranted and that does not reflect in terms of services. And allow me just to mention that this would be a lesson to government, that it is not always about infrastructure project. We take pride, or rather government takes pride in the SGR, in the Thika Road highway, but right now the fundamental things that would make a difference to the Kenyan is water. So we must balance infrastructure and social economic rights, which are rights in our constitution.
Yes.
And I hope that this would be a lesson to say, let us then balance what we put to infrastructure and what we provide in terms of healthcare, we provide in terms of water, and that primary healthcare would be majorly factored in, and not just the machines. Remember that counties right now are contending with the COVID issue also. It's already in Kilifi, it's in Mombasa, but you remember that a lot of resources was just put for the medical equipment, the mess equipment, but at the expense of primary healthcare. So again, our call that is actually look at healthcare, you must balance primary healthcare, because that is what has the greatest impact and is more affordable, as opposed to what we've been doing, like stocking up equipment and machines for the NCDs. So we must try to strike a balance.
Right, absolutely. And as we live in the now, I would like to get from you, you mentioned about measures that have been implemented in other countries to cushion citizens. Could you point out some of the things that have been done in other countries that you have noticed that we could also borrow from and actually ensure that we are not the hardest hit? Because this is not a problem that is exclusive to Kenya, it's a global problem.
So most, I'd say, have what I had earlier alluded to. So there's already tax reliefs that are being given to both the corporate person and the individual person.
Okay.
So that is one thing that most governments in the developed countries have already done. We have seen enhanced sick pay being provided to anyone that already is showing symptoms and cannot go to work. So government is stepping in to take care of this. We have seen government providing loans to business people to ensure that they stay afloat. So we'd encourage government to look, even if it will not be implemented within this period, but there are lessons that we must borrow from, say, Canada, Korea. So these are countries that have really cushioned their taxpayers. And I think in those countries you can then take pride and say that as a taxpayer, the government has stood with you. But for us as Kenya, for government to expect and tell us that they're taking us, are looking at a lockdown or whatever they'd like to put it, but not tell us how they're going to provide for businesses that would have to shut down, for individuals that would not have food on the table, this is completely unacceptable to taxpayers of this country.
Yes, and many people do indeed live from hand to mouth. And as we're looking at our local businesses and our local communities, yesterday we had a statement from the Border Safety Authority in Kenya that was calling on government to talk to landlords to, you know, ease their grip on the expectation on rent payments. They were talking about border riders living from hand to mouth, and therefore some of the things that can be done is to give them the masks or sanitizers and things like that. Do you agree that these measures that might be seen to be more hands-on a direction that the government should be taking right now as a way of helping people keep the ball rolling as far as their earnings are concerned?
True, they are the small, what I would call small but very impactful things that government ought to have done.
Yes.
First is even when we're talking about even the matatu industry, the sanitizers should have been something that government provides, or even the water points.
For sure.
So the same would apply to the border riders. So I would actually then stand with these groupings and economic groups to say that yes, government must do more and ought to have done more. And remember, particularly now that you have mentioned the border,
yes,
most borders have, I give an example of Kisumu. They had actually refused to start paying taxes and fee to Kisumu County because they are not seeing how these resources will come back to them. And I think that is the question they are still asking, because most counties have passed finance bills that have added burdens to the border people. Remember, the Finance Act that we are currently in already said that border people must get insurance to cushion even the people that their passengers. But then what is government saying? So what we as taxpayers are saying is that government is pushing us to do a lot, but they are not doing anything significant. So then government must take its rightful role, but also these economic groups must take these lessons that even this time within our budget cycle, which obviously has been affected by COVID,
right,
it is a time that both national and county level should be having discussions around their finance bills, where they'll then burden taxpayers with more. So it is at this point that we should negotiate as taxpayers to ensure that government gives us something in return to what then they collect from us.
Okay.
And remember, the minimum wage as a country is around 13,000. So with 13,000 as minimum wage, no Kenyan can be able to even save. When we say we are an economy that is from hand to mouth, it is actually informed by the minimum wage. So with a minimum wage of 13,000, no Kenyan has a safety net that when we're on a lockdown, I can be safe for a month. Whatever I earn today or that month is what feeds me.
Now, our first line of defense obviously are medical practitioners, and they are taxpayers. So their lives are definitely going to change if this situation gets any worse. What would you say as the Taxpayers Association should be done for them to ensure that they too are considered by the government as far as their economics and their commercial, the impact on them commercially is concerned?
First, I think we would just thank the medical practitioners, the nurses who are working around the clock to ensure that we Kenyans who are staying at home, they do not have the benefit of staying at home.
Yeah.
So that is something that we appreciate. But their demands, I think, have over the years been very well articulated by the KMPDU and the Nurses Union. It's been issues around even basic equipment. I do remember the last labor unrest by KMPDU was not solely about their salaries, but was more around the working conditions that they have to contend with. So these are Kenyans and taxpayers who have to take on shifts that are longer than necessary because of understaffing. These are players who then, at county level, they do not think they are appreciated enough. There has been a lot of dismissals by county, and so that is another thing that we are encouraging the counties and the national government to address the concerns of these practitioners. Remember, the bone of contention also between COG and the KMPDU was around the issue also of further training for these players.
Okay.
So I think that there are many concerns that these Kenyans have mentioned, and then this pandemic gives us an opportunity to see that there are significant people, that we cannot overpay the political class at the expense of such civil servants. So it's time to relook at our salary scales for these people.
Thank you very much for your insight. Irene Otieno is from the Kenya Taxpayers Association, and those sentiments bring us to a close. You have been watching Morning Express. I'll leave you with J.C. Rogers, who will be taking you through News Center. But for me and the crew that is responsible for this production, I'd like to wish you a great day, and remember to stay safe.